Healthcare facilities are such an important part of communities. It's where babies are born, it's where we go to receive the healthcare that we need. It's critically important to ensure that they're safe, they're healthy, and they're affordable to operate over time.
Overlake has quite a few different buildings from many different eras throughout the years, and one of the biggest challenges with this project has been taking all of those older buildings from, say, the 1980s or even 2006 and modernizing them to current 2025 standards and getting those controls up to date so we could really focus on the energy efficiency and saving energy.
So the project that Overlake Medical Center put together is an incredible project. They reduced their energy use intensity by over 13%, which is very substantial in healthcare.
The project constitutes finding ways to save energy, whether that be in therms or kilowatt hours, any type of energy conservation to drop the energy utility index down from where it started off.
So the state's Clean Buildings Performance Standard is designed to reduce carbon emissions from the state's largest buildings. It's a reporting requirement for many buildings, benchmarking operations and maintenance and energy management plan, and buildings that are using more energy than is allowed based on the targets then need to make reductions to their energy use.
Overlake began this journey back in December of 2021 with an initial energy use of about 230. And what that is just an energy use intensity. It looks at all kinds of things amongst your energy usage. And over the last couple of years, we've taken that energy use from 230 and now we are sitting at 198, and we are continuing to make improvements every day.
The goal of the Pay for Performance program is to provide an incentive structure that can enable customers to expand the scope of their projects and give them as much money as possible for their energy efficiency projects.
The solutions that we can find to provide with them is to actually find those low cost, no cost deals that are simple operational changes and immediately start seeing an impact.
Some of the items were controls upgrades. We've done LED upgrades as well, boiler controls for making them more efficient. We've done insulation projects, we've done door sweeps, we've done just a big mix of items.
One of the more recent projects that we completed was our cooling tower project. We took some really old cooling towers that they weren't functioning properly, and we knew we needed to replace them. They put these new cooling towers on a newer part of the building. We tied that into some existing systems and gained a ton of efficiency.
I think what is interesting with this project is that we're able to be their energy coach. So we're able to teach basic fundamentals and really help them come up with their own ideas and their own approaches in order to do things, instead of having a contractor come in, do everything, and then we're gone the next day.
When we began our project, we were looking at a $20 to $30 million project to get us to a compliance point. Working with UMC and PSC, we brought that down to a $4.7 million project.
What do I hope happens for UMC and Overlake in the future? Number one is that we are their trusted partner and continue to be their trusted partner, being able to support them in new construction, remodels, energy conservation measures. Whatever their needs are, we want to be part of that with them.
Carbon emissions impact global health. And when we think about the power of healthcare facilities reducing their carbon emissions, that seems to be just so aligned with what we're trying to accomplish.